Often you hear children cracking their joints. We're going to talk today about if that's a real issue to be concerned about or not. Joining us again is Dr. Jim Kliamovich from Kliamovich Chiropractic in Sweet Valley and Shavertown. Dr. Jim, great to see you.
And good to see you also, Dave. Thanks for having me.
Of course, you know, kids often crack their joints as a habit. Is this something that a parent should be concerned about?
Well, yes and no. It's kind of a double-sided edge here to the sword. If this is something that's occurring frequently, it can be purely habit, or it could be the sign of an underlying condition in the children. In any case, it should be looked at. They should be brought into the office. Many parents, what they'll try and do is tell their child to stop, don't do that. That's probably about the worst thing that you could possibly do. That's just going to encourage the behavior. But if you can ignore it as long as possible, most of the time it will stop. If it doesn't, again, there could be a sign of some underlying type of condition that maybe they need to be seen in the office for.
What are those conditions that a child may have that would cause them to crack their joints?
Well, there's a wide variety. There could be any type of injury to the joints, anything that's going to cause pressure in through the joints, or which is caused from inflammation or muscle spasm, can lead the children to do this cracking type of mechanism to relieve the pressure in there. And it's a little bit of feel good initially, but over time it can create problems also.
So certainly something as a parent you want to have looked at sooner than later.
Absolutely, absolutely. 9/10 of patients that come in to see me, parents, will be concerned, you know, their son or daughter's grabbing their head and twisting it and cracking it. And they ask me, Doc, you know, how do I make them stop? What's the problem here? You know, is it an issue? 9/10 of the time it isn't, again. But I always tell them, have it looked at, you know, go see your chiropractor, come see us. And find out if there is an underlying condition. Because if this child is doing this repetitively, you know, 8, 9, 10 times a day, 4 or 5 years down the line, this could really lead to arthritic changes in through the child's spine, and we don't want that to happen.
Dr. Jim, your office is expanding a little bit. Tell us about your newest doctor on staff.
We have Dr. David Foltz has joined the staff as of February of this year. He's kind of the younger, newer version of myself. I've been training him in my type of practice and the way that I do things, and he's fitting wonderfully in. Patients love him, and we have a very nice mixture. It's allowing us to see a wider variety of the population, whereas, you know, I've been booked up for quite a few years. This way it allows me to see new patients also.
All right, and for our viewers that would like your help with perhaps their children who are having some issues, how can they get in touch with you?
They can call us at 570-477-2778, or they can also visit our website at kcopro.com.
All right, Dr. Jim Kliamovich from Kliamovich Chiropractic in Sweet Valley and Shavertown. As always, thanks so much for being on the show.
Thank you for having me, Dave.